Hi, it's Pinky here with a baby tip for you for today. Now, I'm going to talk today about your baby's subtle, non-verbal body language, his cues. And when you get to learn your baby's early cues and how they are communicating with you, often you can avert full-blown crying. This is a really good, these are really good tools. Now, of course, each individual baby is going to communicate in their own way, but there are some common signals that can help you. And if you learn these, it's going to be very easy to start reading your baby's body language and knowing what he wants and averting the full-blown crying. I often see mums who've been told if they put their baby in a strict routine, they'll know that when it's feed time, he'll be giving feeding signals, and if it's sleep time, he'll be giving you sleepy signals. But babies don't tell the time. It's better off to learn to get to know your real baby and what he needs when he needs it. And by responding, you're actually teaching him about trust, you're teaching him about emotional regulation, about when he's unsettled, he can be calmed down. So you're really helping your baby's longer term development by communicating and connecting and responding nice and quickly. And you can't spoil a baby. Okay, so crying is often a late signal. Of course, babies are going to cry. This is what they do. This is their way of communicating too. But if you can read these early signals, you'll often find there's a whole lot less crying going on. So first one up is hunger. Baby cue number one, when your baby's hungry. Now with your newborn, watching him, he's going to give really subtle little cues at first, and then he's going to get louder and louder and louder. So at first, your baby's putting his hand to his mouth. That's quite often, he wants to feed. He might make little sucking movements like, oh, he'll be making little sucking movements. If you watch that little baby, and then you might open one eye, and then he might start moving towards you. Sometimes babies make those sucking movements before they've even opened their eyes and ready to actually feed. So, he can do that. And then they'll start moving towards you, like we call it rooting, and they go towards the person who's holding them, towards their chest. They know where that milk's coming from. If you've got an older baby, a few months old, and you don't answer those cues, he might start patting you on the boob or getting quite agitated and moving. Your smaller baby will start making louder and louder noise. And when he cries, his tongue's on the roof of his mouth, his sucking's disorganised, it will be harder to feed him. So by feeding him with those early cues, he's going to drain your breasts better, and he's going to contribute to you making more milk, because if your breasts are well drained, your body's getting the signals to make more milk. So feeding your baby at the earliest feeding cues. Now, play with B, cue number two. Now, your little baby is probably not going to do what you call real play, but they have little periods of time where their eyes are going to be wide and bright, and they're going to be making some eye contact. A newborn can't maintain eye contact for very long, so he'll gaze away and he'll gaze back at you. But it's just really nice that, he's giving you those signals. He'll also have often open arms, open hands, and he'll be, these are the subtle cues. I want to engage with you. Now, for instance, if you're going to do something like baby massage, this is a lovely time to, just take notice of your baby and do some nice little playful things with him. We'll sing him a song. Do some lovely little engagement. You can talk to him, even though he doesn't know an awful lot yet. He's going to love the sound of your voice, and he's going to pay attention. So these are the little cues that he wants to play with you. And he'll look towards your face. He'll look towards your voice. It's quite a beautiful, beautiful time, but his arm and leg movements will be smooth and open. When he wants a break, baby cue number three, I want a break. Your little baby will need a break from what she's doing. They find things very stimulating at first. So they'll give you very clear disengaging. So the play signals are engaging signals, and then these are the disengaging signals, like I've had enough, I need a little break. And often they just look away. They might turn their head away from you. Sometimes they do a bit of squirming or kicking. If they're getting really stressed, they might start spitting up or arching their backs. Some babies will even put their hand up in a little sort of a stop sign. Really subtle cues that your baby needs a little break might be that he's frowning, that he's wrinkling his little forehead. He might be yawning. Now those can be construed as tired signs too. So, just looking at these little signals, your baby, sometimes they might just need a break. You just might need to pick them up, go for a little walk around the room, or go for a little walk outside, change the pace a little bit. Doing that, baby cue number 4 is I'm sleepy. And we're told there's so much emphasis, isn't there, on tired signs. And again, these are going to be really subtle and a little bit different from each baby to baby. And we don't like to be kept awake when we're craving sleep, do we? So neither does your baby, when they're tired. So you have this little window when they show these sleepy signs. And some babies will just become quiet. And those babies are usually just give them a cuddle and they're pretty easy to help to go to sleep. Other babies just might lose interest in people and toys. They might make jerky movements. Their little fists might be clenched. The babies that become very still, they're often babies that are very easy to, help to relax and fall asleep. The yawning, the frowning, knotting their eyebrows, that can be a sign my baby's tired. Rubbing their eyes and ears and fussing, that's usually a baby a little bit older that's rubbing their eyes and ears and fussing. If your baby's a crawling baby, they might start bumping into things or getting a bit, tired on the job. So watch your baby and get to know your baby's cues, and often you'll get to know them and then they'll change them or they'll add in something else that's a little bit more subtle into their little repertoire of cues. But those are all just typical signs that babies will elicit to get your care. But watching your own baby and then responding, and you'll get to know your baby's way of communicating, and you'll know she's hungry, she's tired, she needs a little rest, or she's bored and she needs something else to do. I need to show her something else or sing her a song or take her for a little walk around the garden. And it's always there's trial and error, but you will get to know your baby really well. And remember, you are the expert about your baby, okay?